Thank you. Yes, I'm Professor Lea Berrang Ford from the UK Health Security Agency. I'm filling in for my colleague Anya Gopfert, who couldn't be here today. My apologies if I am less polished than I would normally be. It was just yesterday that we confirmed that I would fill in. So what I'd like to talk about here is really from a government perspective on trying to inform policy. So the UK Health Security Agency rose from the ashes of the Public Health England during COVID, and our role is to synthesize evidence in order to support policy. So we don't make policy, we're policy relevant, but not policy prescriptive. And so I think that's quite important. And what I'd like to talk about today is one sort of journey to explore the case, the health case for establishing thresholds for high indoor temperatures. So really looking at the indoor environment in the UK to inform guidance and policy options. So why are we worried about high indoor temperatures? I mean, I think you've already I'm talking to the converted and the educated already on this. Health deaths are substantial and rising. And really, indoor temperatures, the last presentation, by the way, there you go, was great. And if you have evidence of the effectiveness of UKHSA's heat health alerts, we would like that. I will have to ask you about that. Real negative impacts on health, we already heard that. This is particularly relevant for vulnerable populations. There are a lot of interventions available to reduce high indoor temperatures. Some of these are in the policy realm. And there's precedent for this, not only internationally, but nationally. For example, we do have existing guidance on minimum temperatures, but we don't have anything on maximum temperatures in the UK. So what have we done so far? How did we sort of go about this journey of exploring potential thresholds? So we started with a relatively rapid review of what was already out there in the literature and found there's really insufficient, very high quality evidence. I love how much is coming out through this meeting. Specifically to support health-based recommendations. Much of the evidence uses outdoor temperatures rather than indoor temperatures. The thresholds at which warm environments harm people, there's not one threshold. This is perhaps no surprise. They range from 17 degrees to 31 degrees. This depends, of course, on who you are and what your vulnerabilities are, what the setting is, and to what extent people have control over their setting, as well as which health outcome you're looking at. Are we looking at productivity? Are we considering mortality, morbidity, mental health, comfort? And there are particular settings like homes, care homes, schools that have very different environments. So there's no one real single temperature that applies to all of these populations. We also looked at international regulations, did a review of what's going on internationally. There were 9 countries with legislations. This review specifically focused on high-income countries. 9 countries had formal legislation. 8 had non-legally binding governance or guidance in labor codes. All of these regulations were related to workplaces. So they typically came from sort of through labor codes. There was one case where the guidelines were joint between work regulations and health agencies. 10 had a gradation of thresholds, so not a single number. And 11 of them used air temperature. So not all regulations will use a specific air temperature numbers. Just in the past few weeks, Japan has introduced legislation that's not based on specific thresholds, but obligates employers to take action in cases where people are suffering from heat in the workplace. And the guidance really ranged anywhere from 25 to 28 for legislation, all the way to sort of 22 to 20 to 30 in the case of non-binding guidance. And there were cases where legislation or regulation used temperature indices to try and account for things like humidity. So we did a workshop with the Physiological Society, a really wonderful report and fantastic collaboration, so thank you for those of you who are here from the Society. We deemed that there was really no or insufficient evidence for a single binary temperature threshold that wouldn't really be suitable. The number of variables to have sort of a stress index was quite complicated and probably not feasible as well. There's a real lack of evidence for vulnerable populations and how their temperature thresholds differ, other than the evidence is strongest among older adults, other vulnerabilities, and health conditions, for example. We can't sort of break it down by individual health conditions. Older adults often treated as a homogeneous group, but have very different vulnerabilities, as other presentations have highlighted. I've talked a little bit about some of these other points already, so I think I'll jump to the next slide. So what did we decide? Here are sort of 6 of the outcomes of that workshop and that report. We flagged really the need to work across sectors. So with health, transport, labor, academia. So there's often the challenges and the gaps are in bridging knowledge across sectors. There's quite a number of research gaps, particularly in high-risk groups and vulnerabilities. There's a real challenge around communicating how much can be done through passive cooling and what opportunities are for active cooling, such as air conditioning. And there are a number of implications for both inequality and for maladaptation when thinking about how we can cool indoor environments. And we also need to decide what our goal is. Do we want people to be comfortable? Do we want to avoid health conditions? And there will be trade-offs there if we were to put guidelines in. So for example, one of the concerns that's on this slide is really if you do have guidelines or regulations, what are the implications of that for people ceasing to work? Are they going home to an environment that is hotter or even less cool? What are the implications for the labor force? And I think the last presentation was a really good introduction to some of these issues. So when it comes to really moving from research evidence into policy, it's quite tricky. So you don't just, as many of you will know, you don't just generate evidence and therefore it gets dumped into policy and something happens. Evidence is really passed through this pipeline of government priorities, public opinion, and really there's often windows of opportunity in which you can influence the development of different policy options. And we really have to be opportunistic. So much of what we do is working to prepare the evidence, so summarizing the evidence and packaging it and translating it in ways that speak to the needs, the priorities, and the questions that are coming from policy partners, as well as trying to address research gaps in advance of and in anticipation of these policy windows of opportunity. And that also means developing relationships across government with different partners, which is where meetings like this are very, very useful. And one of the challenges in many cases is the difference between policy and research timelines. Often we have 24, 48 hours to summarize some questions coming to us from Parliament, and that's very different from the timelines in academia and research. So some of the mechanisms that are available to us that we use to mobilize evidence. Publications, so the government as messenger. We published, for example, the Health Effects of Climate Change report, which was one of our obligations under the Climate Change Act. in the National Adaptation Program. These can be quite impactful because they're representing evidence, sometimes put through a lens that may ideally be more relevant to policy colleagues, or they're seen with the stamp of having the weight of government messaging. Perhaps one might argue that nowadays that stamp and that weight is changing. We often also have to submit ministerial briefings and respond to parliamentary questions. These can be very, very rapid. You could have a 4-hour turnaround, and that's to synthesize evidence and messages really, really rapidly. It's an opportunity to increase a minister's awareness of a certain topic, and we really have to have evidence and awareness and syntheses at hand right away, often not primary evidence. This evidence already has to be synthesized and at our hands. In communicating and framing of the key findings, we can put out press releases. We run, for example, the heat health alert and heat response toolkits for the public and for health and social care. So there's often teachable moments, especially during heat events, which is when ministers and our communications see that as an opportunity to really reach people who, again, window of opportunity, are ready to and interested in taking in that messaging. If you tell them in the middle of winter, they might just not be interested. We also work to create cross-government relationships. A lot of the interventions that will be needed to protect health from heat lie outside of the health sector. Building design, land use planning, in private sector work environments. And so our levers in the health sector, in the Department of Health and Social Care, are actually quite narrow. So these cross-government relationships to make sure there's a health voice in policy development in other sectors is really, really important, and that's where the cross-government engagement is both a challenge and an opportunity. And then this also applies to working with local authorities. Again, often the interventions will need to be implemented, and in many cases funded by local authorities who don't always have the capacity to implement. All right. So what are our next steps? We're really taking a focus at the moment on the social care sector, which is where there's the highest concentration of the most vulnerable people when it comes to heat, and working on piloting some passive cooling interventions for really different levels of risk. So what are the sorts of things that you could do? A lot of these things are quite basic. Things like closing the blinds, closing curtains when it's hotter outside than inside, looking for opportunities for airflow and ventilation. So some of the very basic stuff, looking at opportunities in social care, because you can really cool environments by a huge percentage. I think it's somewhere between 40 and 60%, but my team can correct me on that, just through passive cooling mechanisms. We're also continuing to identify key research priorities and working with academic partners to have those conversations, both to get their insight as it comes out, as well as to share where the potential opportunities are. And then working with partners to jointly identify appropriate levers for policy impact. So how can we package that evidence to support guidance, to support legislation, depending on where really the appetite is to do policy implementation. And any questions you can ask me now, or Anya, and we also have Dan, if you want to stick up your hand and wave. Dan is also from our team, and so you can corner him during break and ask him questions as well.
So, yeah, we do have time for questions. Thank you for sticking to time. So, and yeah, you've got the hand there.
Thanks. My question relates to public awareness about the dangers of heat regarding death. I assume that all the data on heat-related deaths comes from population excess death data rather than anything on individual death certification, because without individual death certification, nobody knows that Aunt Dora died of the heat.
Yes. The short answer is yes. We look at excess mortality, so we have modeling to look at excess mortality associated with excess heat. So yeah, it is a statistical analysis that will capture those people for whom heat contributed and is not sort of written on their death certificate. So yeah, there's some pretty good, robust modeling on that, so yeah.
Yeah, so,
You told me to be short with
my
my
answers.
answers.
That's great. Thank you, because there's always more time to expand in the panel. I was just going to say that's really interesting because, of course, as we all know, poor little Ella Kissy-Debraj is the first person who actually has air pollution on her death certificate, where it's actually that the individual is identified. And you're right. Generally, we have population, and we can't actually point and say yes. We can attribute this. This early death too. So thanks for that question. Okay, we will. It's a very quick question. Yeah. Oh, yeah, there's a mic. No, we need it for people online.
Okay, great. Hi, UKHSA, University of Exeter. I was struck by what you said, that in your workshop, you showed that a fixed binary temperature was not considered suitable for indoor temperature thresholds. And I guess my question is, what does it mean for our messaging around temperatures? Because we send heat alerts and warnings. We kind of need something simple that says, if it's this hot, this is bad for you. How do you reconcile this kind of, like a simple binary temperature is not suitable, yet we need to message clearly?
I will give you a very short example. Our heat health alerts, the red, amber, yellow, actually use different thresholds for different regions of the UK. So in London, people are more adapted to, the south, people are more adapted to heat. So the threshold at which we would issue a red alert is actually higher than it might be in the north. So you can have nuance behind the scenes in understanding differential vulnerability, but translated into something that is quite simple, like red, amber, yellow. So that's just one example.
Brilliant, thank you. So did we clap? I can't remember. We clap again if we did.